For sure. I'll have the latest on the forecast in just a few minutes. But first, now at 5, an alarming number of COVID cases reported yet again in the state of Ohio. 7,087 cases in just 24 hours. That, of course, compared to yesterday. Now, keep in mind, yesterday had another high number, but that included cases from over several days. Today's number, the highest daily case count since January 15th. Now, the higher numbers are also swinging our 21-day average, which has now jumped to almost 4,000.
Betsy, same story with our hospitalizations. They continue to tick up. Another 240 patients statewide entering Ohio hospitals in the last 24-hour period. You can see the number on your screen there, that 9.6% number. That's the number of hospital beds available that are taken up by COVID patients. Just last week, that number was 7.8%. Going the wrong way.
It is. But today, the state's top medical leaders sounded the alarm on the spread here in Ohio.
3 News reporter Lydia Esparra joins us now with What's New on the What's New set. And Lydia, good afternoon to you. The Ohio Department of Health spoke today. What are they saying about these latest numbers?
Well, Jay and Betsy, they had a lot to say. And of course, none of us want to hear what's going on. And this is not what we expected for this Labor Day weekend. There are going to be massive crowds in many cities, and they're saying we all need to be careful. Dr. Bruce Vanderoff, Director of Ohio Department of Health, says we are trending in the wrong direction. And in the end of the day, it will take everyone getting vaccinated to get us through this pandemic. And while he's not saying don't attend those Labor Day festivities, he says we have to be very, very careful.
If you're in an area where social distancing isn't possible, you need to be thinking about putting on that mask.
Put on that mask, use the stuff for your hands, everything. And statewide, 1 in 8 patients in the hospital have COVID. 1 in 5 patients in the ICU are battling the virus. Those numbers, they, of course, increase in mostly the rural areas. And they're warning it's all across the state. Everyone across the state is having problems with this.
Well, we keep, pushing the vaccine. There's so many people who have already had the virus, and now they're saying, well, we don't need to get the vaccine because we've had the virus. Are they actually protected? Are the antibodies really doing their thing?
That's a great question, Betsy. They are protected. They do have the antibodies. And I'll use my brother as an example. He had COVID, tremendous amount of antibodies. However, he still got the vaccine because that only improves your chances of not getting Delta or COVID-19 again, because you really can. So vaccination. On
top of the previous, if you've had it.
That's what we always talk about. Layer up.
That's it.
There's a lot of different things we can do to make sure that we stay safe. Lydia, thank you. Appreciate it. Now, there is some good news on the vaccine front. A new survey suggests hesitancy is declining. 70% of adults polled said they already got the vaccine. 8% said they plan to get it. The remaining 20% said they're unlikely to get it, but that number is down 3 percentage points from just 2 weeks ago. It also shows that the number of parents who plan to get their children vaccinated is also growing. In fact, that number is up 12% in 2 weeks. Here in Ohio, we are lagging behind the national vaccination rates. Nationally, 53% of all residents in this country are fully vaccinated.